Welcome to Physician Heal Thyself, the podcast, empowering you to take a whole person approach to your well-being, spirit, soul, and body. Join me, your host, Dr. Ana Lara, naturopathic doctor, entrepreneur, and a servant of Jesus Christ. We are not just a body, we are spirit and soul. It's time to integrate medicine and spirituality into our healing. Let's get started. Welcome to Physician Heal Thyself, the podcast. I'm your host, Dr. Ana Lara. Today, I want to talk about understanding what is ADHD and how to take a natural and holistic approach to screening and for treatment. So if you or someone you know is struggling with ADHD, this is definitely an episode that you want to listen to and that you want to share with others. So we're going to dive deep into what are some natural health and wellness ways of heal, right, from the inside out. But more importantly, what are some ways to properly diagnose? Because what I see oftentimes, that the way that this disorder, which ADHD, in case you don't know, stands for Attention Deficit Hyperactivity Disorder. So we're going to talk about what does that mean? What does it look like? How are people diagnosed? And what are some of the typical traditional ways that people are treated, and then some natural ways to go about it. So definitions we're going to talk about. With ADHD, it is a neurodevelopmental condition that's characterized by three things. Inattention, so you're not able to keep your attention and focus on something. Hyperactivity, and also impulsivity. So you can have impulsive behaviors when you have a condition like this. So the three main types are the inattentiveness, which is the ADD part, the hyperactivity, the impulsivity, and then you can have a combination of both, right? So how this can affect someone daily in their life is they can have a difficult time focusing on one task for a particular time. Usually they have one thing, they're focused, and something else will take their attention. It could be something so small, and then they never go back to completing the task that they started to begin with. They can have difficulty with organizing things. But on the flip side, right, we're going to talk about how it can also make them hyper, wanting to be organized in a certain way that if something is changed or out of their normal, they're not happy about that. So completing tasks is something that usually, people will have a hard time, and it's because it's almost like they have too much information. Their mind is being driven to one place, too quick from one place to another, so they're not able to complete a task. They'll start one thing, they'll move to another, and they get hyper focused. Emotional, regulation struggles, so they'll have some difficulty with emotional regulation. And oftentimes it's because the brain is overwhelmed with overstimulus. It can impact school, work, and relationships. And so some of the myths is that, some of the myths that we want to dispel is that it's not always about hyperactivity. It's something else. And it's not caused by bad parenting. And there are many times, there's many adults that have been undiagnosed with ADHD. And I will even say, when people come to my office and they've told me my child has been diagnosed with ADHD, I always ask, what did they do to diagnose? And here's the things that conventional medicine will do as screening tools, which I am not in complete agreement with. So some of these are going to be evaluations, so interviews. They go through a kind of a behavioral checklist, like does your son, your child do these things? And so these tools, there's two tools. One is called the Vanderbilt Assessment Scale, and this is used for children. It's a questionnaire. And the other is an adult ADHD Self-Reprot scale, also known as ASRS. And this is a questionnaire, once again, that people will fill out. And that's pretty much it. If you score high on that, you or your child have ADHD. And of course, there's also input. Usually school teachers will start to bring it up to parents' attention. Your child is not sitting, not following directions, not completing tasks. and that usually will alert them to present that information to the parent. And then the parent usually takes the child to a doctor and they get assessed. So sometimes I get parents who bring their child to me and they say, well, the school's telling me that he or she needs to get screened for ADHD. And I say he because it's oftentimes more common in boys, but it does happen in girls as well. So I'm not a big fan of just going based off of a bunch of questions. And I know that in conventional medicine, that's the approach they take because they don't know the other options. But I want you as my audience to know there are other ways to screen for this condition. We first have to understand several things. One of them is, gut health. I did my previous episode was on gut health, so you might want to refer to some of that. But gut health is very important because if they don't have proper gut motility, there's anything that's compromising the gut inflammation, right? Any food sensitivities, this can cause neurological effects. So some food sensitivities like gluten and MSG are neuroinflammatory foods, and or neuroinflammatory ingredients, and they can cause neuroinflammation, which will result in behavioral hyperactivity issues. There could be sugar and food dyes. We know that oftentimes food dyes will impact the way the brain will function. So you want to make sure that these are things that you're eliminating from your diet, your child's diet, because it will only make matters worse. And when you remove these things, you're going to see some of that hyperactivity, reduce. And then we want to also look at the second point I want you to think about is any nutrient deficiencies. There are so many nutrients, and if we're deficient in any of these nutrients, then remember that these nutrients are the building blocks to making everything, including our neurotransmitters, our brain function, our every process of our body. There's a nutrient that needs to go there to build it up. So if there's nutrient deficiencies, even low vitamin D, right, can make someone feel depressed and tired and have effects on their immune system. So there's a lot of other vitamins that if they're deficient in, because there's gut inflammation, it's going to cause also inflammation in the nervous system, right? The quality of sleep is important in these cases with ADHD. Oftentimes, though, it is the hyperactivity, the ADHD situation going on that will not allow them to sleep. So it's not that they don't want to go to sleep, it's that children, usually see this in children, they have a hard time falling asleep and staying asleep. And usually it could be correlated to those neurotransmitters, if there's too many of them that are excitatory and keeping them up. And once again, it could be gut health and nutrient deficiencies. I want you to start thinking, as I'm saying all of these things that could be contributing to the root cause of ADHD, I want you to start thinking about how they all are correlated with each other, how they interconnect with each other. They're not this or that. It is all of that. So we said gut health, nutrient deficiencies, sleep quality, and the other that we see a lot in this modern time is screen time. All the technology, all the sensory overload that children start to get exposed to at a very young age, it does impact the way their brain is wired, the way their brain functions. So if their brain is already overloaded and overstimulated, you want to do the opposite. And so the less screen time, the better. If anything, this is where I do feel like parenting is the problem. Because with a child, if you do not set those limits with the child on how much screen time, or not even having them have access to screen time, because you don't want this child to have an emotional outburst, then they're going to manipulate you through their emotional response. And so you're going to give in as a parent to keep them calm and quiet. And, you're tired, you're exhausted. I get it. But it's only contributing to that hyperactivity. Obviously, trauma and stress is something else that could contribute to, making symptoms of ADHD worsen. But here's the number one thing that I right away go to. So when someone's in my office and they're like, I think I have ADHD, or my child needs to be screened for that, I immediately turn to recommending doing a neurotransmitter test. This test that I perform on patients, they do it at home, but it is a urine collection. They collect 4 different samples throughout the day, collecting the urine and sending it off to a lab. The lab will process and report these neurotransmitters. And it's a pretty extensive neurotransmitter test. It is 40 different markers. And these markers, are, like I said, they're quite extensive. We're talking about some of the markers that we're looking at, like glutamate. So there's, let me back up. There's different categories of neurotransmitters. Some neurotransmitters are excitatory neurotransmitters, and those can be glutamate, histamine, dopamine, right? Norepinephrine, epinephrine, acetylcholine, and oxytocin, and there's a couple of others that are excitatory neurotransmitters. Then you have a category that's inhibitory neurotransmitters. So these are what helps us to calm down, to regulate serotonin, GABA, glycine, taurine, and 5-HIAA, which most of you won't know that, but that's okay. It's an inhibitory neurotransmitter. And then there's other neurotransmitters that like tryptophan, tyrosine, tyramine, 5-HTP, serine, L-dopamine, all of these, and there's many more. And some of these neurotransmitters have a dual effect. So without us really looking at what is the brain doing, where are these neurotransmitters at? For example, if someone has really high levels of GABA, GABA is a hormone that makes you feel good. But if you have too much, it's too excitatory, it'll make it be difficult for you to focus. If you have high levels of glutamate, which is an excitatory, it will also be overstimulating. So this is where the foods that you eat, the things that you supplement with, you need to be careful with, because oftentimes people will say, well, I tried magnesium and it didn't help, it made it worse. Well, what kind of magnesium did you use? If you use a magnesium glycinate, and that glycinate form is going to feed into a certain pathway that increases GABA, that increases glutamate, that increases an excitatory neurotransmitter, you're not helping your situation. You're just guessing, and now you're just making matters worse. So even if something is normal, if we don't know why we're using it, we don't understand by values of what's off, then you can make the situation worse, including with herbal medicines. Herbal medicines are medications. They're medicines. They're natural, but they have they function on these neurotransmitters. Even things like lavender and lemon balm, they work on these neurotransmitters. And so if we don't understand the pharmacokinetics of it and how these herbs work, and we don't know our values, what's up, what's low, then we can make matters worse. But this neurotransmitter test, it's always going to help me understand baseline. Where are their neurotransmitters in? And typically, if that child has that hyperactivity or difficulty with focus, then these neurotransmitters typically align to what their symptoms are. Now, in some cases, there are other testing that might be necessary. They might not even have ADHD. It might be something else. It's neurological, but it might be something else. And this topic really would deserve its own episode on the podcast when we're talking about conditions that are caused, like autoimmune conditions that attack neurotransmitters they're usually caused due to infectious disease. There's other testing that can check for those inflammatory markers and autoimmune markers against these neurotransmitters. And it's usually through a full assessment of the patient, what they're presenting, what they're sharing with me, and a bunch of questions that I ask. When I get the full history, then I can determine, we should really do a neurotransmitter test and a neural Zoomer Plus test, because we're going to look for all the inflammatory markers, all the infectious disease that's coming up, any autoimmune markers against the nervous system, against these neurotransmitters. That's looking at, is a blood-brain barrier compromised, is there neural inflammation present, and so forth. So, we can really get deep down into that. So there's other testing that people can do to really fully diagnose, is this ADHD or is it something else? And so once we have those assessments, it makes it easier to go about approaching treatment. So These tests, neurotransmitter test is about $270. These other tests can be $200, $420. It really is not a lot of money when you think about it. When you're really going to have a clear picture of what's going on with this individual, it's worth the investment. Insurance won't cover it because it's not standard of care. And this is one of the things that I've talked in previous episodes, the reason that a lot of doctors who are natural or functional doctors won't work with insurance, because it does not fit their standard of care. And we know that the standard of care is not going to get you anywhere. So if you want to heal, this time we'll need to invest into our health and well-being, especially when it's a child, and this is going to be something that they're going to have to deal with for the rest of their life. It is worth knowing what your neurotransmitters, what's going on there, so that you know what foods are going to affect certain neurotransmitters, things to avoid, things to add, what to do, have better tools, right, to navigate these issues that you're experiencing. Because really, I don't like the label. I don't like to label someone with ADHD. Let's really what does that even mean? Like, let's really take a look at what's the physiology behind that label, what's really going on. So I want to share with you, the next part is what are some natural holistic treatment approaches, right? Once again, this is just information, it's just for educational purposes. I am not treating you. If you're not my patient, I cannot tell you what to do, but it's just kind of common sense information now. So the very first thing is going to be diet and nutrition, eliminating those foods that are triggers, processed foods, artificial dyes, foods that are high in sugar, and drinks that are high in sugar and dyes. Consider gluten-free or dairy sensitivities. I find that gluten oftentimes can definitely be a neuroinflammatory chemical found in foods and pastas, and many processed foods. Unfortunately, gluten is in them. And, I always share my situation. I'm not gluten sensitive anymore, but many years ago, if I had gluten, it would just put me in a coma. It would change my mood, made me feel moody, just irritable, could not concentrate, a lot of brain fog. So gluten can definitely be something and dairy that, you might be sensitive to. You might have to eliminate that. Additives like MSG, MSG will worsen symptoms. It is hugely a neurotoxin. Gluten and MSG are, they're neurotoxins. That's it. And nobody should have that in their diet. Some of the supportive nutrients are going to be your omega-3 fatty acids, so your EPAs and DHA. The brain loves fats, healthy fats, that is. So give it those omega-3s so that it can keep thriving. Also helps to reduce inflammation. So if you have, neuroinflammation, that omega-3, fatty acid is going to really help to reduce inflammation. Like I said, magnesium, but you got to be careful because there's different types of magnesium. I don't even know how many, but there's a lot of them. There's magnesium, 3 and 8, is really helpful for focus, memory, concentration. The 3 and 8, magnesium 3 and 8 is really good for that. But your glycinates and citrates are good for some people. Glycinate, I always caution people who are very hyperactive. Zinc, iron, B complex vitamins. I always say if you're going to get a B vitamin of any sort, make sure it's methylated. And that's something else to consider, is that some people have difficulty with methylation, meaning the conversion of vitamins to its active form. So you may want to consider testing genetically for MTHFR mutations, because if there is a homozygous mutation in that gene, they're very most likely to not be able to convert these vitamins to the active form, like B12 and folate, right? And so then it can create a toxicity and inflammation and a lot of detox issues in the detox pathway. So you want to make sure you're doing methylated B vitamins. Some of the herbal natural supplements, the herbal supplements that I recommend, but once again, you really got to do this under the guidance of an experienced and trained practitioner, not someone who did a weekend herbal class. That is not enough. This person really needs to be a botanical, like a botanist or a naturopathic doctor, someone who has gotten extensive training on herbs and how it impacts neurotransmitters. There's a whole science behind this. Just because it's natural doesn't mean everybody should be taking it. You need to understand what the herb does, how much to take. The dosing for children and adults is very different. And then depending on which neurotransmitters are elevated and which ones are low, then you're going to have to decide where to start dosing, maybe start lower. But things like rhodiola are adaptogenic herbs, so it helps with stress. Ginkgo helps with focus and cognition. And then you have things like an herb like bacopa, which is, I love it. Bacopa is great for memory and attention. And then we have lemon balm, which is calming. And I know that lemon balm has an impact on GABA. On GABA and many other neurotransmitters, so you want to be cautious with how much you use of lemon balm, also known as Melissa. This herb also has an effect on the thyroid. So it's good for people with hyperthyroid, but not good for someone who has hypothyroid, so low function thyroid. You want to be cautious on how much of lemon balm you are taking. Very calming herb. Obviously, there's lifestyle and behavioral outlets, tools for people to consider. Exercise is going to be a great way to get some of that excess energy from the person, the child. So getting some physical activity is always important. Meditation, prayer, meditation, just mindfulness, things that help slow down that impulse control, that impulse reaction in people can really help. Even if at first you struggle with calming down and sitting down and meditating, calming the mind down, it will be a practice that takes time. So being patient with it and giving it time for your nervous system to calm down. And we know that people like, routine and structure. They need a structure, they need a routine, and they like predictable schedules. This is where I want to talk about some of these behaviors that people experience with ADHD. Especially with children, I always like to present it to them as like, there's a superpower here. Like, oh, look, you're so focused on this one thing and you like things to be organized in such a way. It's not always a bad thing. Or maybe this person can juggle more than one thing at once. Maybe letting them explore 2-3 things that they're going back and forth. I don't claim to have ADHD and I'm not undiagnosed of ADHD. But when it comes to certain work activities that I do, I find myself going between 2 or 3 things. Sometimes I'm reading 2 and 3 different books at a time, changing them up around the week. And so that's okay. That's not a negative thing, The problem is that oftentimes schools, because there's 20, 30 kids in a classroom, and they expect every child to sit in a desk for this period of time, and some children can do it and some can't. They have energy in their body. So this is where I think boys, they're meant to move. Boys are meant to move. They have more muscle mass, they have more energy, and men are designed to move and to work and to use their bodies physically. It's not that girls are not meant to do that, but because the way and the physiology of a male is different, right? Regardless of what people believe, they're going to have more energy. They tend to be more physical. So they need shorter periods of time to learn and then more physical time to move around and do things, or do things with their hands. They like to touch. They like to do that. So that's okay. You need to explore your child's, personality and what they're good at. I mean, have you seen some of these kids learning an instrument? Like, I saw this video of a kid. He looked like he was 5 or 6 years old playing the drums. And I thought, wow, I bet that kid would be diagnosed with ADHD. But he has a skill that he's able to use his brain, use that energy in such a way. And so maybe this is not a medical condition, a diagnosis. Maybe it's just a gift too. So it's also the way you look at it. Don't look at your child like something's wrong with him or her. Maybe let's explore ways that he or she can use that behavior to, optimize himself, learning and growing from there. The problem is when the condition with these symptoms start to affect their physical health, their mental health, their sleep, right? That's when it's not good, when it's over consuming the child's health. We wanna regulate and help come in. So the diet is gonna be huge. These herbs are gentle, it can help. the lifestyle, getting them moving, right? Teaching them other ways to slow down their brain, breathing exercises, short breathing exercises where they can slow down their brain. There's things like, and I can post this in the show notes. I can link it also if someone wants to download this, but there's a technique that helps people with hyperactivity to slow the brain, and it's a physical activity with breathing exercises along with that. Spending time in nature, I always tell them, take your shoes off and go run outside. Go put your feet on the dirt, on the grass. It's almost like there's too much electrical energy in their brain, and this is a way of grounding that wild energy. It just neutralizes them, and it tends to help. So parents, let your kids go outside and play in the dirt. They're not going to die. It's good for them. Go play in the dirt, climb on trees, play in the grass, be outside. And sometimes we do have to look at environmental toxins and things like that of that sort. So are there synthetic fragrances and toxins in your home? So we want to look at the environmental chemicals that this child is being exposed through diet, fragrances, cleaning products in your home, detergents that you're using, shampoos, all of that. Because some people, especially if they have a MTHFR mutation, they will have a hard time detoxifying from these things, and it will impact our brain health, right? So some children, some adults are very sensitive to EMF exposure. So you want to, address that as well. And like I said, reduce some of that screen time. Let them go out, move, play, instead of having them hyper-focus on this technology. So oftentimes with ADHD that I find, there is oftentimes a link to sleep struggles. So they will have some insomnia, difficulty falling asleep, staying asleep. And so this is where you have to unwind them. A good neurologist will tell you that we should not have any brain-mind stimulus 2 hours before we go to bed. So if your child's going to go to bed at 9 p.m., at 7 p.m., there should be no stimulus to the brain, no technology, nothing that would overstimulate them. So maybe creating a ritual for nighttime that's calming them down, unwinding them, a bath with some Epsom salt, maybe some lavender essential oils that you spray in their room, some of those herbs that we talked about, like passion flower, lavender, lemon balm, chamomile can help. Melatonin in children, you want to be cautious. For short term is good, but not long term. Now, if a child has low melatonin levels, which there's a test for that, it's most likely due to digestive issues, right? So we would want to address the gut issue as well. So sleep is really important, because if they're not sleeping enough because of the hyperactivity, then you will create this vicious cycle. And that's usually what happens is the hyperactivity does not allow them to fall asleep. And then from not getting enough sleep, that will contribute to the hyperactivity. So it's a vicious, ongoing cycle that we need to help them to unwind at the end of the day, help them calm down. So maybe I used to have my kids go outside and play, run outside, bring them in, give them a bath, unwind them, and then they would go to sleep. And so that can be also very helpful. So some additional, functional tests to consider is that food sensitivity test, because if there's food sensitivities, that could be a problem. But before even doing food sensitivities, a gut microbiome analysis would be helpful to see if there's any inflammation in the gut as well, not just in the brain, but also the gut. And then like a micronutrient panel to see what nutrients are they deficient, or which nutrients are they excess in. So I know I've shared a lot of information, but I am really passionate about this topic, because I do oftentimes get parents that are concerned because their school told them that their child needs to be screened for ADHD, or they did take the child to the pediatrician. They asked them a couple questions, and based on that, they diagnosed them with ADHD. And then they want to put the child on harsh medications without a real solution, without really identifying what's the root cause. You're going to put this child on medications that will have side effects with long-term use. And I know that a lot more parents are concerned about putting their child on medications for ADHD. And then it's so sad when you see these children, when they are on these medications, they're just like turned off. They're just like not there, and that's not the way to live either. To be honest, I'd rather have my child be hyperactive than to be sedated. So please take this serious. There are ways, and the purpose of this episode is to talk to you about that there is testing, and the very first place to start is that neurotransmitter testing, which is easy because it's a urine collection with your child. You're not poking them, to assess what's going on with those neurotransmitters, and then coming up with a plan, a strategy for diet, nutrition, the herbals to take, lifestyle, and talking to the child and educating the child as well. I work with children with these conditions and other, neurodivergent conditions, and I always talk to the child and teach them this information so they understand it's not coming from mom, it's not coming from dad. Like, this is going to help your brain to feel better. And when children start to understand and implement these changes at home, even if they struggle at the beginning, what I start to see is that the child will tell me how they feel. And then when they do have the blue slushy or the cake that had blue dye or something that they haven't been eating for a while, their brain, they feel it right away in their brain, and they don't feel well. And they feel it in their gut as well. And so when they come back and tell me, I ate candy or I had some cake and I had blue coloring and it made me throw up or it made my head hurt, I didn't feel good. And the parent is like, yeah, they regressed and they had, about a week where they were moody and irritable and hyperactive. And then we had to kind of detox them from that. The child starts to identify themselves, this correlation of what they ate and how they feel and the impact that food had on their brain health, on their body. And so now they identify that, they make that connection, and they're like, I'm not going to have that again because I didn't like how I felt. And let me tell you, oftentimes these children are probably more compliant when they experience that negative effect after not having that food. Now they're like, I didn't like the way I felt, because they have a contrast of how they felt originally when they were hyper and not able to focus and their moods were dysregulated, to feeling well, and now they have a food and they're dysregulated. They have a comparison and they can decide for themselves. And so that's the way that I work with the patients that are children, but some adults have this as well. And not every case is the same. It's not straightforward. And so we have to do investigation on that. I want to hear from you. What has been your experience with, if you personally have ADHD, have you gotten some solutions or not? What are some questions you have? Please reach out. You can respond in any of our platforms with questions. You can always reach out to my clinic. My clinic is Raíces Naturopathic Medical Center. I'll put all the information in the notes of this podcast. If you're interested in learning how I can help you or your child, you can go on my website, schedule a free 15-minute phone consultation where we get a little bit of details from you. I share how I work with patients, and then from there, we move forward to what approach to take with you or your child. So do not succumb to this simple little questionnaire that they have you do to determine if you have ADHD, and then you're labeled with ADHD. Do some work, do some investigation, do the testing. Let's really do the work to identify the root cause and then come up with a strategy for your healing. So I hope this information has brought you some, fresh insight and hope that you can regulate this ADHD, this hyperactivity, your inability to focus. And even if you heal 80-90% of that, I bet you that will be a huge transformation for your life. So reach out if you have any questions. I'll put in the description how to contact me. And until next time, be blessed. Thank you for listening to Physician Heal Thyself, the podcast. If you like what you've heard, please like, share, and subscribe. Help this message reach more people who may need to hear it. Leave your comments. I want to know what you think. If you're interested in learning more about Raices, visit our website at raicesndmedcenter.com. Until next time, be blessed.